Folate receptors, these are responsible for transporting folate into the tissues in the body. So we take in folate through our food, it gets absorbed into our bloodstream, and then these receptors are on the tissues to get the folate into those tissues. There are 15 different pathogenic variants in the folate receptor 1 gene, which encodes the receptor of folate alpha. This is essential to transport the 5-methyl tetrahydrofolate, or the active folate, into the central nervous system via the choroid plexus. So this is that blood-brain barrier that the folate must get through to get into the central nervous system. Folate receptor alpha is located at the blood-brain barrier and at the placental barrier, facilitating the physiologic folate transfer to the brain and to the developing fetus. And this is the key area that we're looking at here when we're talking about folate receptors. So we do know that if you have cerebral folate deficiency, which is a deficiency of folate in the central nervous system, brain, this was first described only 17 years ago. It's actually around the time I graduated from medical school, and published in the New England Journal of Medicine. So cerebral folate deficiency is found in patients with low levels of the biologically active form of folate, 5-MTHF, in the brain. This can be measured in the spinal fluid. This can be present even if folate levels on blood tests are normal. And this is actually really important, because when I'm talking with patients about this possibility of a folate deficiency, they will often come back and say, my folate was checked, it's normal. Yes, your folate may be normal in a regular serum blood test, but unless they did a spinal tap and looked at folate in the cerebrospinal fluid, they could still be deficient in the central nervous system. In patients with this, there's an inability to transport it across the blood-brain barrier, which results in a functional central nervous system folate deficiency. And the neurological consequences of this include seizures, delayed motor and cognitive development, autism. We're talking about really early onset autism here, poor head growth, cerebellar ataxia, visual and hearing impairment, dyskinesia, and spasticity. So this severe cerebral folate deficiency can start around 4 months old, with irritability and sleep disturbances. And the most common causes are the presence of autoantibodies to folate receptor alpha. There's 2 types of antibodies, blocking and binding, through mutations for the gene for the folate receptor alpha, or for the genes for MTHFR, which is that genetic genetic condition in which we do not code for the enzymes that convert folate into active folate in the body. So this is a known condition. This one is well accepted and understood by mainstream medicine. Now, I like this graph. Bobrowski and Corey in 2021, they've been doing a bit of research on the folate receptor antibodies. I like this because it really walks us through the effects of folate deficiency on the fetus and brain development. And they're looking at all the different possibilities here that can cause folate deficiency. So folate malabsorption, we talked through that, low dietary folate, genetic defects, and then folate receptor antibodies. And again, the folate receptor antibodies is what we're focusing on here. I have another talk on MTHFR, but we're going to really focus on the antibodies here. So any of these can then lead to folate deficiency, which then can affect pregnancy and fetal development and postnatal brain development and function. And you can see all of the different types of effects that this deficiency can have, which then leads to neurological disorders and ASD, which stands for autism spectrum disorder. So then we've got the clinical presentation down here. Now, down here, this infantile CFD syndrome is what I was just talking through. This is relatively well understood, and this is occurs when there's a very severe folate deficiency from the very beginning. Now, these, as we go further up in age, these are less well understood and less well studied, but Bobrowski and Corey are basically proposing, hey, this is how the folate deficiency can show up after those first 2 years, and where it's often missed. So 2 to 5 years, we could see spastic ataxic syndrome, intellectual disability and learning disorder, developmental dysphagia, and visual deficit. 5 to 12 years old, we might see Asperger's syndrome or a less severe form of autism. I don't think Asperger's is the preferred term anymore. Psychotic disorders, hearing loss from 6 years old and on, and then above 12 years old, they suggest dystonia and schizophrenia. And this is new information. This is not something that most mainstream docs or psychiatrists who are looking at things like schizophrenia or autism spectrum disorder are thinking about, but I would say they should be. Ramakers is another researcher who's doing a lot of research on folate receptor antibodies and central nervous system folate deficiency and how it may be manifesting. Again, starting down here, early onset, we can see infantile autism and neurological defects. Then he's also walking up the age here, spastic ataxic syndrome. Here we see ADHD, 2 years old, see early onset ADHD. Think about this. Dystonia, schizophrenia, and psychotic disorder, especially when it's showing up really early like this. Think about this as a contributing factor. Refractory or treatment-resistant depression. And then way up here, dementia. Now we're seeing dementia being suggested as a possibility of a manifestation of chronic low folate in the central nervous system. So let's talk about these folate receptor autoantibodies. So folate receptor autoantibodies these are actually attaching to the folate transport in the blood-brain barrier or in the placental barrier. They can trigger inflammation and they can create a partial block of folate transport to the brain that it utilizes the folate receptor alpha. So most of these autoantibodies are IgG and they can readily cross the placenta. So again, this is highly problematic in a developing baby. They did a rat study where they were administering folate receptor autoantibodies to the rats and creating issues. What they found was if they gave active folate, which is called folinic acid in this study, and dexamethasone, which is an immune suppressant, so they were reducing inflammation and increasing active folate. They found they were able to improve communication, learning, and cognitive deficits. So this is basically saying, hey, if you have folate receptor autoantibodies, the solution may be to reduce inflammation and bring in some active folate, and then we can actually see significant improvements. So this is in 2017. And this is really what I'm talking about us doing for our patients. So several studies suggest that DL-leucovorin, which is an active form of folate, it is available, a very similar form is available commercially. It can bypass the blockage of the folate receptor alpha by using the reduced folate carrier, which is an alternate pathway to get folate into the central nervous system. And this can substantially improve symptoms in children with autism disorder, especially those who are positive for these autoantibodies, which makes sense. Autism spectrum disorder may be addressed by addressing the folate receptor autoantibodies. Now, as most of you know, it's becoming more common. 2017 study says 1 in every 68 newborns in the USA is affected. Evidence-based medical treatments, at least by the FDA in the US, are limited to only 2 medications, which are risperidone and aripiprazole. And these are really just to treat irritability, so a symptom of autism spectrum disorder. And in fact, methylation and redox abnormalities are so prevalent in autism spectrum disorder that biomarkers of these are proposed to be diagnostic of autism spectrum disorder. So this is Fry and company. They are publishing some studies to this effect. And this tells me that as integrative or functional medicine practitioners, there's so much we can do because we can work to improve methylation pathways, redox abnormalities, and really see some nice improvements in function for people on the spectrum disorder. All right, schizophrenia, not well studied as far as looking at folate receptor autoantibodies, but there's a little bit of information out here, and I think it's worthwhile because schizophrenia is very difficult to treat. It is usually chronic, and medications can be ineffective, can cause a lot of side effects. Compliance is definitely an issue in this population. So folate receptor autoantibodies are associated with refractory schizophrenia, which means hard to treat. Maybe they've tried multiple medications without success. And what we see is that those folate receptor autoantibody titers fluctuate, affecting the folate flux into the brain, influencing homocysteine, tetrahydrobiopterin, which is a cofactor for the enzymes that produce dopamine, serotonin, and nitric oxide levels. This can also be addressed by looking at folate receptor autoantibodies. So if you treatment-resistant depression like I do, I have to really gear up and know that I'm in for a challenge when I have a new patient who has treatment-resistant depression, because I know they've tried a lot. They're still not feeling well. A lot of them have tried so many medications. A lot of people come to my clinic already on 6 medications and still have really severe depression going on. One study showed central or cerebral spinal fluid metabolite abnormalities in 21 of 33 participants with treatment refractory depression. And the cerebral folate deficiency was the most common one, with normal serum folate levels and low cerebral spinal fluid active folate levels. Again, normal blood tests, but deficient in the central nervous system. Okay, so there is an interesting connection between human folate receptor alpha protein antigens and the antigens present in all animal-derived milk and milk products. So among genetically susceptible patients, the ingestion of cow's milk after birth predisposes the intestinal immune system to produce antibodies, which can enter circulation and cross-react with the folate receptor alpha antigen attached to the choroid plexus, the thyroid, and to gonads. So an animal-derived milk-free diet can downregulate this production of autoantibodies. So this is actually saying that if you are taking in cow's milk or possibly any animal-derived milk, then that could be fueling this autoantibody process. Okay, so we suspect cerebral folate levels could be low. What do we do next?